Good. Barbara Oster? Barbara, welcome. Good to see you. Welcome.
Good evening, and thank you for the opportunity to be here. I had the opportunity several times this week to have conversations with Mr. Gardner, and he asked if I would come and let you all know that Salvera Medical Cannabis Dispensary has opened across the street, just a couple of blocks up, with very little to do. And just want to tell you a little bit about what's been going on. We have seen approximately 600 patients to date. Surprisingly to me, they all look like me, especially during the daytime. Everybody's gray-haired, elderly, and sort of at the end of their traditional therapeutic rope, and which is why they've decided to turn to cannabis. But I also wanted to talk to you about 2 or 3 of the programs that we are running. One thing I'm very proud of is that I already have 5 opioid-addicted patients that we are beginning to bring down off of their opioids by adding cannabis to the regimen. Cannabis does 2 things. It mitigates any of the withdrawal symptoms that they might have, and it potentiates the opioids so they can use much less with the same kind of pain relief. This speaks well because one of the reasons that people don't get off of opioids is because they are suffering from withdrawal symptoms and can't do it. Secondly, we have a program that's an end-of-life program, and I had the opportunity just before Mr. Gardner and I had a conversation on Saturday to work with a patient who is end-of-life, who is in hospice care, who really, and it was announced to me that their very last resort, and that's why they were there. The first time I didn't realize that they were end of life and they were on hospice care, but the second time I did, and I was able to provide them with over $1,000 worth of product on Saturday for a penny, because we have room and budget to take care of 10 patients who are end of life. The last thing that we do on a routine basis is we are really trying to gather our veterans in the city of Bowie in an opportunity to help them understand their PTSD, have a psychiatrist work with them for their PTSD, and see if we can mitigate some of the symptoms that we're having in hopes of bringing them back to the opportunity of being a productive and valuable citizen in the city. So I wanted to come and talk a little bit about that and let you know what we're doing and offer an invitation. Anybody who wants to come and see, and I think you would all feel better if you would come and see, are welcome to come to 4201 Northview Drive at any point between 10 and 7 p.m. and ask for me or ask for Jerry, and you're more than welcome to get a tour.
Okay.
Thank you.
Thank you, ma'am.
Thank you very much, Bob.
You're welcome.
Dustin, Suzanne?